is up, YouTube? Alright, seriously, it's been a long freaking time. A long time. What has happened in 4 years? We have 2 more kids. We bought a house. Not in that order. And we're just living life. So we now have 3 kids total. And we've decided that our family is complete. Yay! So my husband went and got the snippy. He's a saint for doing that. But he went and got a vasectomy last year. So between that and my breastfeeding, I'm still breastfeeding. I have a 13-month-old daughter. We haven't really had to worry about this sort of thing. But my cycles came back. So we had talked about this a while ago that I was going to get the Mirena IUD placed because my cycles are just horrible and they always have been, and I have a progesterone issue and a thyroid issue. So a lot of hormonal things, and so we decided that we were going to try that. And so, let's see. I went in on Monday and got it put in. I seriously spent more time in the waiting room waiting for that freaking thing, like to go back to get that thing in, than I did getting it inserted. It was easy. I freaked myself out a lot. My blood pressure went up really high because I was so nervous about the pain. Because you guys, Google loves horror stories. Let me tell you. It is one thing to educate yourself about the risks and benefits. An informed decision, I think, is always important. I think it's very important to understand what could happen, both the good and the bad. With that said, if you've made the choice to go and get it, do not go near YouTube or Google and search for horrific stories. Or don't even search side effects after you've, gotten yourself educated about it. Because, I did that. I freaked myself out so bad. You guys, this, is not a big deal. At least for me, it wasn't. Maybe for some people, it is. I've given birth vaginally 3 times. And yet, I was still, petrified of this thing, going in my hoo-hoo. And that's ridiculous. So I can't comment on what it feels like if you haven't had kids or have had kids but not vaginally. I don't know. So this isn't the blog for you if you want to know about the pain tolerance for that. I can't comment on it. But basically, I went back there and, the first nurse does all the things that they do, like check your blood pressure and your weight and all that. And then you undress from the waist down and yada, yada, yada. And then the doctor comes in. She had me sign a form, probably signing my rights away if anything happens. It goes bad, but whatever, it's fine. And so I signed that, and then, I discussed my concerns over it, and she was very understanding. And then we basically got started. So, who was that? So we got started, and what she did is at first she just gave me a pelvic exam where she just kind of palpated the top of my uterus from the outside of my stomach and then inside too. And then after she got an idea of where my uterus was, she inserted the speculum that goes in that opens everything up so that they can see, and she kind of looked in there to get a little bit better idea. And then she cleaned it all off with, I can't remember the name of it. It's very, very similar to iodine. Is it called Benadine? It's very similar to iodine. It couldn't be the same thing, but, so it's just something that they use. They use a sterile thing to apply that, and then they clean everything off really well, including your cervix and your vaginal wall, and so that you don't get an infection. The next thing she did was she took a rod, and it's probably about, I would say, as thick as a pencil, maybe a little bit thinner. and it's really long. They call it a sound device, and it's probably like 12 to 18 inches long. I don't know. I mean, it's like horrifically long, but don't worry, you can't even really tell. So she puts that in, and she says, I'm gonna dilate you a little, and she used some sterile tool to do that. It could have been the same thing, I don't know. And that sounds really horrible, but I didn't feel anything. Like, honestly, it felt like pretty much like a pap smear. And so she did that, and then she put the rod through my cervix up into my uterus to measure it. And this is the part, like, why you should get somebody who's had a lot of experience, because those crazy risks of, like, perforation with, or them getting embedded or going through the wall or whatever, a lot of times it has to do with the fact that, like, the care provider just needed more good practice. So that's something I would highly recommend, is going to somebody that has had a lot of experience and they really know what they're doing and they're not just like, just learning. Anyways, so she did that, and I want to say that my uterus was like 9 centimeters or something. I don't know. It's pretty big. I guess it's what happens when you have like so many pregnancies so close together. So she took that out, and she said that she needed to use a clamp. It kind of like pinches the cervix in order to hold the cervix steady, because when she would try to put it through the cervix, it would be fine, but then the uterus would kind of just move because there was nothing holding it there. So she pinched it, and she said that that'll burn. It did burn. It did feel like a burning sensation, pinching a little, and that probably happened for like 5 or 10 seconds, and then it went away. It was totally gone, no problem. The next thing she did was she put the sound device that puts that, because the IUD, like, it's in the shape of a T, but it goes up like this, and then eventually they have the arms come out once it's in place. So she put that rod up there, and that was fine. It honestly, like, it felt like it kind of tickled, actually. Like, seriously, it felt like this tickling sensation inside my uterus. It was the weirdest thing. It tickled more than, like, baby flutter kicks. It was so weird. It was like somebody was tickling me from the inside of my womb. And so she did that, and then she said, okay, I'm putting the IUD in, and then she's like, this might hurt for a minute, or cramp was, I think, the word that she used, or discomfort, something like that. And when she put the IUD in, it didn't hurt. But what kind of got uncomfortable was when she went to release the arm, like the top T part of it. That's where it got uncomfortable, but it was manageable. I mean, it's not a walk in the park. It definitely felt worse than a pap smear, which to me, pap smears don't hurt, but like, it was definitely more than that. But it wasn't unmanageable. Basically, if you've ever given birth, it kind of felt like a contraction in like early to mid labor, maybe, or like a really bad afterbirth pain. It lasted like 35 seconds, I think. And then it went away, and it was a done deal. She took everything out, took the speculum out, and wham bam, thank you ma'am, we were all done. Pretty easy. I had, she gave me the follow-up care. You can't have anything in there for like 4 or 5 days so that you don't risk an infection. And then obviously there would be spotting, and that the symptoms can last 3 to 6 months before your body decides that it's gotten used to it. She was pretty confident that I wouldn't bleed as much as other women, because that was my first cycle back, because I've been breastfeeding, so like the lining of my womb hasn't built up like most women's would have. So that's nice. I'm almost on day 4 now, and I'm not bleeding anymore. I've had I had like a light flow the first day, and then just spotting for a couple of days, and now I'm golden. I don't feel it. I don't even notice that it's there, which I'm surprised with, because I'm very in tune with my body. Like, like I just know when I'm ovulating. I just know, like, all these different things, and so I figured I would notice it all the time. But unless I go searching for the strings, I don't feel it at all. And I do have a tipped uterus, so although she did tell me it moved positions to like midway anterior, but it was tipped, so I don't know. But I'm just saying, like, I didn't feel it. For pain relief, I took 800 milligrams of ibuprofen right, like, I think a half hour before the insertion. And then basically I just alternated between that and acetaminophen for the first 24 hours. And I just kind of took that regularly because when I wasn't taking it regularly, I would get cramps, and I would say like they're like the equivalent of a heavy flow day of cramps. And so then I was just taking it around the clock for the first day or two. And then after that, I haven't needed it ever since. It's great. I've noticed I've only had it a few days, so maybe I'll get negative side effects. Maybe I won't. But so far I've noticed that my moods have improved greatly. I do have postpartum depression, and I do take Zoloft for that. But I've just noticed I've just been more content in general. I've been wanting, it's just been different. Like, I just feel different about the way I am towards my husband and my kids. And I just feel like better about stuff. Like, I don't feel like such a bitch. Which is ridiculous, but it's true. The other thing is my milk supply has actually increased, which some of you don't know, but I have insufficient glandular tissue, which was probably caused by my progesterone and thyroid hormone deficiency whenever I was developing. And so basically it is a physical breast abnormality where I cannot physically produce enough milk because my body didn't form all the milk ducts and glands in order to do that. And so I've always had to supplement. And so my daughter has always had about 10 ounces of supplement a day. Well, in the last day, she hasn't had to have any supplement at all. And you know, she is eating a lot more, and she's also teething, so maybe between those two things, that could be why. It could just be coincidental. But I have noticed that, like, I do feel a little bit more full. So, you know, I know some people say, like, oh, the Mirena ruined my milk supply. And, you know, maybe it did. Like, I believe that it can. I've met a lot of people where it have, and I've met a lot of people where it hasn't done anything. But I just wanted to share my experience because I really do think that it was related for me, and I've had a benefit of my milk supply increasing a little, even if it's not significant. Like,